Desert Oasis Healthcare believes knowledge is power, and it is so important to us that all of you feel empowered about your health and informed, especially as you get older, because healthcare can be so intimidating to everybody. And today we want to break down Medicare Advantage versus Medicare Fee-for-Service. I brought together a wonderful panel for all of you. I want to start with some introductions here. We have Dr. Brian Hodgkins, the EVP of Clinical Operations at Desert Oasis Healthcare, Melissa Diaz, the Director of Member Growth and Retention, and Brian Bilhartz, the CEO of Bilhartz Desert Insurance. And we're talking to our 65 and up audience right now about Medicare Advantage and the different options they have. And I just want to start hopefully making everybody feel a bit comfortable. You've shared with me that you have clients who have had very successful careers back in their day, and they're still confused about it, yes?
Yeah, absolutely. People think, well, maybe I'm the only one that doesn't understand how this Medicare stuff works. And it's not true. It's so complicated. It's so confusing. It seems simple when you talk about the letters of the alphabet, A, B, C, D, but there's so much more to that.
Let's break it down. And I asked them to please speak in layman's terms as simple as possible for all of us, myself included. So let's get to it. Medicare Advantage versus Medicare Fee-for-Service. How could you describe it very simply, the differences?
Yeah, the difference is if you choose to just go with original Medicare or Medicare Fee-for-Service, you're just taking that red, white, and blue card that you get with Part A, Part B, and you're assuming the deductibles and fees that are associated with that plan. Whereas choosing to go with the Medicare Advantage plan, I think a lot of people misunderstand that if you're taking an additional insurance, you have to pay extra for it. Right. But a Medicare Advantage, you actually don't have any additional premium. So you're not paying anything above and beyond, but you're actually getting much better, much more complete coverage for your medical services and other services as well.
So, Melissa, how is coverage differ between the two, essentially?
Well, the coverage is different. One of the main differences with Medicare Advantage versus fee-for-service are the extra benefits that you get with Medicare Advantage. Mm-hmm. So Medicare feels that you don't need to have vision care or dental care or hearing. But with Medicare Advantage, those things are included in your benefit structure. Every plan, for the most part, with Medicare Advantage has those benefits for people. So additional benefits, no additional premium other than your Medicare Part B premium that you have to pay no matter which you select, and coordinated care. So those are, for me, I think the biggest additions for Medicare Advantage.
Why are there two different options, Ryan?
You'll have to ask the government. They haven't really did it. I think for a long time, the government, CMMI, which is just the way Center for Medicare and Medicaid Services, has looked at experimenting with try to control the cost of care while not giving up on the value and the outcomes. And a long time ago, we heard it stated as though they're going to outsource and privatize Medicare. But the experiment really was, can we find an avenue, provide all the care that Medicare does at a lower cost and get better outcomes while paying the same or less? And that experiment started a long time ago. And today we have many health plans. I mean, Brian's the guy you want to talk to because even in the business, I can't tell you how many plans are available locally.
Right.
And selecting the one that's right for you and your healthcare needs and your quality of life and health right now and your pocketbook, all those are important. But the data on it is pretty, I think, firming up in that Medicare Advantage is now achieving better outcomes than Medicare Fee-for-Service at a lower cost. And I would not be surprised if 5-10 years from now you hear Medicare Advantage for all.
Well, I think you hear people a lot talking about network versus no network, right? What do they need to know about that?
Well, with Medicare Advantage, you do have to use a network of providers. You're referred by your primary care doctor to any specialist that you may need. With fee-for-service Medicare, you are, in essence, able to go to any provider that accepts Medicare. So again, that puts the burden of finding the care and finding the specialist on the member, the patient and their family versus having someone assist you managing your care.
And I want people to truly understand the benefit of having that primary care doctor really managing everything. With Desert Oasis Healthcare, it's your team. You get calls for reminders about whether it's a colonoscopy, a mammogram, right? You get calls that it's time to see this specialist, and they make all those referrals for you. So can you talk about referrals under when you have a original Medicare?
Under original Medicare, so Medicare Fee-for-Service, the advantage is wherever the wind blows you for your care,
Sure.
You can go. You could be in any state. You could be in any city any county, and you can get care with your red, white, and blue card, as Brian says. Now, there are Medicare Advantage plans where you get coverage across the United States as well, and you'll get care, especially emergency care. But I always say care is provided locally. So in our community right here in the Coachella Valley, Desert Oasis takes, I think, 15 or 16 various Medicare Advantage plans. So we cover literally 1 in 3 seniors across the valley to provide care. That's pretty impressive when you think about it. And so we have a network, all the hospitals, we have a lot of tertiary care facilities, and your primary care doctor, if you want to see a specialist, like a neurosurgeon or an orthopedist for a knee replacement, they're going to send a note, we call it a referral, to that provider to see you. They've done all the background work, they've done the x-rays, maybe the CT, MRI, they've packaged that and they've sent it to the specialist. So that specialist doesn't have to repeat all that stuff. They get the package, they look at it and say, hey, Brian, come on down. I'll see you next week and we'll talk about the care plan going forward. So the government really doesn't like referrals because they see that as a barrier to care. But the reality is it's the way you make sure patients get all the care they need and just the care they need, and you feel comfortable that what's being provided for that patient is really what they need.
I know money is such a big part, of course, of how and why people make their healthcare decisions, right? Can you talk a little bit about out-of-pocket costs and how it differs between original Medicare and then Medicare Advantage?
Yeah, that's such a great question
Right.
because if you're looking at just original Medicare, without any type of secondary plan, there are no out-of-pocket limits under Medicare fee-for-service. And you think about that fee-for-service payment model. If the doctors only receive fees when they provide services, they're going to overutilize the system of a system that's already strained or constrained by, not enough providers out there to service, our population. So there's no out-of-pocket limit under original Medicare. And when you look at that 20%, we often kind of put that back on our clients or the people we meet with, like 20% of what? Do you understand what the cost of an MRI is, the cost of an emergency room or ambulance visit? And so when you have original Medicare and you don't have that safety net, you're really putting yourself in harm's way. Whereas under the Advantage plans, there are Advantage plans that have an annual out-of-pocket maximum below $200 for the entire year.
So it's essentially more predictable too, which is comforting
Oh,
for people.
absolutely.
Can you talk
Yeah.
about that?
So patients know what they're going to, when they're meeting with an insurance
Right.
broker, they can actually tell them what their costs are going to be for the entire year for their medications. And they know that they're not going to spend any more than the maximum out of pocket for that year. So like Brian said, $199, you're not spending more than that for the entire year. That doesn't include medication, but the agent can also give them basically down to the dollar how much it will cost on their current medications for the entire year. So no surprises, no, crazy bills that put you in bankruptcy. We hear about medical bankruptcy for seniors, and it's truly devastating. It can be really, really an unfortunate situation. So completely transparent, what you're paying for the whole year.
And look, the reality is a lot of seniors are on a fixed income, right? So they need that predictability just for their own sanity too, right? To have peace of mind, which I think is what so many people want in their later years. Can you talk about that too?
We meet with people where they live.
Yes.
We go into their homes, into their environments, and we get a quick glimpse into their world. And, there's so many seniors here locally in the Coachella Valley that are just, struggling to make ends meet on a day-to-day basis. And so many of them still just hold that red, white, and blue card by itself, not knowing what other options are out there for them. So when we sit down and we start going through the predictability of these, benefits through the Medicare Advantage program, they start welling up with tears. They go, oh my gosh, like why was I never explained this before? And, part of me says, well, I'm glad I'm the one explaining this to you now because I know I'm going to take good care of you and walk you through this hand in hand. But, to know how many people don't know about it still here in the Coachella Valley, that these programs exist, and you have Desert Oasis that's going to give you really the highest level of care and continue to push the envelope to make sure you're living your healthiest possible life.
Brian, you've shared this before, and I would ask you to share it again, that I've heard you say many times your own family, you encourage them to be members at Desert Oasis Healthcare. That, I think, speaks volumes about the safety and trust here within this organization.
I say next to your primary care doctor, I would tell my mom again, the most valuable person when you turn 65 and you have a stack of mail like it's been coming for years, and your art magazines are starting to show up early, is you need to have someone on your side who understands not the intricacies of healthcare, the complexity, but simplifying it based on what you need, not what everyone else needs. 50% of seniors in Coachella Valley live on under $40,000 a year. Half of 110,000 of our seniors here. And we have the extremes of wealth and poverty in this community. And so you need to have someone like Brian and his team who can cut through all the clutter, sit in front of you and tell you, while they're handing you the bills that they're paying, how can I afford health care? With a plan that gives me everything I need: hearing, vision, dental if I need it. You need that just as much as you need, a good primary care doctor.
Well, everyone has different health needs, to your point. I think that's why it's important not just listen to your neighbor or a relative who says, oh, you got to do this, Susie, right? Because at the end of the day, you need a plan that's designed for you.
Absolutely. It's your health.
Right. And I know there's so many extra additional benefits for Medicare Advantage. Can you share a little bit about that, Brian?
Yeah, well, and I mean, first of all, to go back to what you just mentioned, Desert Oasis accepts 15 different insurance companies that offer 99 plans. So think about that. I mean, it's a massive, for people that try going to Medicare.gov on their own to research this, or use Chat GPT to research this, like, how do you whittle that down? And that's, what we do is we focus on each individual to make sure that we're addressing what their specific wants and needs are. But when you look at original Medicare, and it's what Melissa had alluded to earlier, I don't want to say that Medicare doesn't believe you don't need those things. I think Medicare cannot afford to offer vision coverage, dental coverage, hearing coverage to every Medicare beneficiary, because it's very, very expensive. But these Medicare Advantage plans, because they're able to, work with organizations like Desert Oasis that is able to control costs and not have, a lot of waste and abuse within the healthcare system and services that beneficiaries receive, they're able to offer these additional services that are so beneficial to every individual's, overall health and well-being. I mean, dental is so critically important to each of our health, right? Vision coverage for eyeglasses, hearing aid coverage. I mean, a lot of companies will offer grocery benefits to people who qualify, over-the-counter items like vitamins and Band-Aids, even transportation that helps get them back and forth to their providers. There are so many different services that these Medicare Advantage plans offer above and beyond original Medicare, still for zero monthly premium.
So when we're talking about original Medicare, we know there's a 20% co-insurance, right? How do people protect themselves in that scenario?
Yeah, so they do have the option to purchase what's called a Medicare supplement plan, which works secondarily to original Medicare. And those plans, they're insurance products, so every year those premiums go up. So when you start off, when you first turn 65, they're relatively inexpensive. I mean, not compared to Medicare Advantage, but they typically start about $150 to $160 a month. And then on top of that, you have to purchase a separate Part D prescription drug plan, which there's some companies that the premium for those Part D plans are over $200 a month. But I think the thing that a lot of people don't realize is those premiums on the supplemental plans, not only do they go up every year, but they can go up multiple times throughout the year. I remember I had a situation where somebody was on a plan that within the same calendar year, the premium increased by over 30%. And this person was paying over $400 a month for their supplemental plan.
And likely they had a fixed income, right?
Yes,
at
they
that
did.
age. Yes.
Absolutely. They just didn't know Medicare Advantage existed.
And that's the supplement, plus you have your Part D premium, plus you have a drug plan. So when you're looking at the total cost for Medicare fee-for-service versus an HMO, you're only paying your Part B premium for Medicare Advantage. The supplemental, you have the supplement, the D, the
dental,
the dental,
vision.
the vision.
Yeah.
And it can end up being close to $600 a month, even more per person in your household. If you're two seniors, that's $1,200 a month that you're paying for your insurance versus $400 a month Medicare Advantage. So
the goal, of course, is better outcomes, right? The long-term health. And I'm curious, just given your medical background, if you can share a little bit about data out there that shows that when you have managed care with this Medicare Advantage, here within Desert Oasis, for example, how that leads to better outcomes, medically speaking.
Well, we believe in if you think about all the screening that we do to keep you well. So all the mammograms, the colonoscopies, getting if you're diabetic, getting your diabetes under control. If you have a chronic illness that lands you in the ER a lot, in our organization, we are measured, and we say you treasure what you measure. We have to be the best at this because expensive care happens in the hospital. So we make sure that all the primary care screening gets done. We make sure that we call it 5-star care, but we're 5-star, meaning we get the best possible outcomes on these screening measures. Because when you screen and caught stuff early, it doesn't, snowball down and get a major problem. If everyone did that, the cost of care gets lower because all that care is provided in the primary care doctor's office. Last couple weeks ago, we had a mammography truck in our parking lot, so that women could come here and get their mammography while they're seeing their doctor. And we just make it easy to get the care you need, where and when you need it.
Medication adherence is one of the other things that is extremely important for keeping patients healthy. And so we have an entire team of pharmacists and pharmacy techs that help our members. If they're having a difficulty with medications, it's not, it's upsetting their stomach, whatever the case may be, we have an entire team behind our primary care doctors working with them to make sure that they're on a medication that works for them, not, any crazy side effects, and that they're able to continue to take it every day to keep them healthy. So that's super important as well.
Yeah, as well as making sure that those medications are affordable. They also find programs to make sure that they're, helping reduce out-of-pocket costs when possible.
I'd like to end going down the line. If people could take one thing away, if they're trying to choose between original Medicare and Medicare Advantage, what is one thing each of you would like everybody that's listening and watching to know?
I think with Medicare Advantage, you get all the benefits of Medicare fee-for-service, and then about this much more. Mm-hmm. You get no access issues, less out of pocket, better health, and peace of mind. And just knowing that someone's going to care for you, coordinate care around you, have a team around you of nurses, pharmacists, technicians, social workers, all quarterbacked by your primary care doctor. I think that is invaluable versus an unfettered team of individuals who are scrambling just to see patients to make a buck.
Mm-hmm. Yes, Melissa.
Well, I would say, Desert Oasis offers monthly meetings for patients that are getting ready to turn 65 to learn about Medicare. So I would highly encourage you to take the time out to come spend a half an hour with us, learn about the differences between Medicare and Medicare Advantage, and make your own decision based on facts, not listening to your neighbor or, someone on YouTube telling you, you don't want to do Medicare Advantage. The facts speak for themselves. When you sit down with a broker, a local broker, and they tell you about all the different benefits that are offered with Medicare Advantage, people literally cannot believe it. Like, they're like, well, how much does it cost? How can you do that? How does that happen? And so it's really explaining to them that we're able to give you all this care and it's going to be a lot less expensive for you every month. So super important. Mm-hmm. And that gives you more money to spend on things that you want to do. So it really does make a huge difference in people's lives.
Indeed.
I think comparing original Medicare to Medicare Advantage with Desert Oasis, I would say simple, affordable, and complete. I think with Desert Oasis, your care is very simple. You have your primary care doctor that's guiding you every step of the way. You have all the care coordination services that Desert Oasis offers. It's obviously affordable. We talked about zero premium for these Medicare Advantage plans and all the additional benefits. And it's complete because when you have a system like Desert Oasis that is looking at every aspect of your well-being, again, it's really the best system available.
And this is an age where people just want to be focused on their grandkids, right? Not having to manage all these doctor's appointments and think, oh gosh, am I late for this or do I need to be getting that? And I would imagine it's such peace of mind knowing you have this organization behind you trying to take care of all of that. We'll put information up on the screen so that everybody knows about these classes, right? And mydohc.com could definitely give you all the information you need. And of course, if they want to get a hold of you, Brian, tell us your information.
Yeah, my local number is 760-848-7171.
Perfect. Thank you all for being here, and I appreciate you all watching to empower yourself about your health.